I want to talk to you today about my passion. My passion is very similar to almost everybody in the mental health field, and that is to make sure that everybody has access to the services they need or want. Let me ask you guys a question. Anybody ever felt sad, angry, lonely, anxious, nervous? I see a couple nods. Those of you who aren't nodding, I'm assuming you're not listening or you're in complete denial. Because we all feel that sometimes, right? We all feel negative emotions sometimes. And that's totally normal. And we all have different ways that we deal with it. We might exercise, we might eat, we might spend time to ourselves, or we find someone to talk to, right? Therapists are trained to give you a safe space where you can talk about whatever is going on with you, whatever's on your mind, without having to worry about any repercussions. You don't have to worry about your brother going and telling your mom what you said. You don't have to feel guilty that you've burdened your significant other with the stresses of your day at work. And therapists are trained to not only listen, but help provide guidance and a safe space for you to talk about whatever's going on. I'm biased, but of course I think everybody should have someone like that. And there's been a major move in psychology in the last probably 15 years or so to make sure that people do, especially people that are determined to be high need, as we would call them, and that's usually poor urban families. When I was in graduate school, after graduating, I worked in community mental health centers where that is the identified population, and I can definitely say that there is a dire need for services there. But I realized really early on that there is a whole group that we almost completely neglect, and it's probably not who any of you think. So let me ask you another question. If you guys saw the mayor going to a therapist's office, would you question his ability to lead? You might. Some of you yeah, some no. You might. There's a really popular political drama on TV right now, and about 2 seasons ago, the President of the United States was basically kicked out of office after it came to light that he and his wife were in marital counseling. People questioned whether he could handle the stress of the job, whether he had anxiety issues, whether his relationship was getting in the way, and he was basically forced to step down. And obviously that is fiction, but that's reality for a lot of people who are worried that if it was discovered that they were seeing somebody, that people would question whether or not they could even do their jobs. Think of the CEO of a company you guys might invest with or whose products you might buy a lot of. If you found out that person was in therapy, you might be like, maybe things aren't going that well. Maybe I don't want to keep buying products from these people or investing my money with them. And it's not just politicians and CEOs. Athletes have been in the news a lot lately. Domestic violence, anger management, substance abuse, impulse control, head trauma, right? The media is happy to say, so-and-so, they should be in marital counseling. Well, maybe. But can you guys imagine going to a therapist's office and having to sign autographs while you wait to talk to your therapist? Or looking over your shoulder to make sure nobody's taking your picture because you don't want your private business all over the tabloids and the news the next day? And this is anybody who could potentially be recognized. So this is singers, actors, even political activists or volunteers. Anybody with a public image has to worry about seeking help due to stigma. And I don't know about you, but to me it's really scary when the people who make our laws that influence you guys and influence me, can't go decompress for an hour a week. I think we can all agree that's probably a pretty stressful job, and I would really like them to be as unstressed as possible before they make those decisions. Anybody else? Yeah, right? What about role models? The people who our kids watch and look up to. When those people can't go learn anger management skills or impulse control or get substance abuse treatment without repercussions, that's scary to me. And of course, there is a bigger issue here, and that is the need for society in general to become more accepting of the need for mental health care. The problem is those changes take a lot of time. There have been growing acceptance for mental health care for a while. There are some major cities, New York's probably one of them, where a lot of people see somebody and it's even normal to have someone that you talk to. But then there are other areas where it's not. And the problem is societal change takes a long time. One example of this is desegregation. A lot of you that I'm looking at probably were not alive when that happened, and yet today we still have major racial issues in our country. Gay marriage is a much more recent example. It is now federally legal, and yet we're having a really hard time as a country accepting it. Now these are obviously very different examples, right? But the point is that any change on a societal level takes a long time. And as therapists, we can't just sit back and wait for society to catch up. we have to make changes now that make services available to everyone. What does that mean? That means private offices, where people don't have to worry about being recognized in the waiting room. Even running into a neighbor can be uncomfortable, right? It means flexible scheduling, because when you're running a country, or running an office, or running a family, you don't necessarily know what next Tuesday at 4 o'clock looks like. And we need to be able to schedule around people's lives. It means being available where people need us, going to their private homes, their private offices, being available to our clients when and where they need us, not the other way around. And when we do that, when we make services available to everyone, it helps to destigmatize it for everyone. Because when those same people in power, again, whether it's real power or just social power, can stand up and say, you know what? I see a therapist. For 1 hour a week, I put down my cell phone and I focus on me. I talk about what's going on in my life, I talk about my stresses, and I decompress, and you know what? It's good. And I feel better, and I do better at my job, and my family life is better. When those people can stand up and say that, it normalizes being mentally healthy. The same way when those people post online pictures of themselves at the gym, it normalizes being physically healthy. So when we go out of our way to make services available to everyone, those same people help to normalize and make services available to everyone else. It's really important that everybody have access. A lot of change has needed to happen in our society. As I said, a lot has. But it's time for mental health to step up to the plate. Thank you so much for your time.